think it's going. Does it say, did it give
It's,
you a
it's
thing?
recording, yeah.
Okay,
They
cool.
gave me a little notification.
I'm sure I'll have to edit this later. Well, okay, so we're here with Mariana Granados, who is a medical assistant at Rancho Mirage Women's Health Center. Thank you so much for taking the time to let me interview you. How are you?
Yeah, I'm doing well.
Hmm.
How are you?
Doing great. Pleasure to be here. So, first of all, thank you for taking the time with me. I would like to start off with just basically asking you how you got into your position and what are your basic responsibilities, like a basic overview.
Okay, so my mom is a medical assistant and has been ever since she moved to the US pretty much. She just did her training and started working for my uncle who owns the practice that she works at and that I work at.
Cool.
So he's an OB slash gynecologist. So we take care of pregnant women and women's basic feminine care. And so what I do is I record vital signs. I I record patient information. Um, I just do. Or I also administer certain medications, and I help out the doctor that I'm assisting that day. So
Awesome. Awesome. How long have you been doing this now?
about, about half a year.
Okay, cool. Very cool. So it's new.
Yes, fairly new.
Awesome. Can you tell me about any of the training that you've had prior to getting this position?
Yes, so I sort of started off working at my uncle's office in high school, just doing filing and office clerk type things. And then when I reached college, I started getting into the medical field. And so I did the training for medical assistant, and then I started off at my uncle's office. I sort of had an in, so and my mom enjoys it, and yeah, it just seemed like an easy access job that paid well.
Awesome. Awesome. Is there a most satisfying part of your job?
Most satisfying part of my job, I guess, would be feeling accomplished. Like I know that I'm just sort of like a helper to a physician, but um, it'd be like just knowing that I could help fulfill a request, like refill of medication, or like I don't know, just simple little tasks. Like okay, I did something. Like I helped out someone. I could have, yeah, just helped in any way.
Awesome.
I wouldn't say anything in particular, or yeah, that'll be my answer.
Okay, awesome. How about the least satisfying part of your job?
Well, I don't want to get into the gruesome details, but you know, it is gynecology, so you are
Mm,
head to head with female anatomy all the time, which I'd say has deterred me from wanting to specialize in gynecology because it's not my cup of tea. But you know, it is pretty interesting. It is very like hormone based. Like it's a lot more um, like endocrine system than it is just the female reproductive system. Like there's
yeah,
a lot of underlying things, and it gets pretty interesting.
that makes a lot of sense. Um, could you briefly describe like your work setting, if it's consistent?
My work setting
Yeah.
is very consistent. Yes. So I sit next to the same people all the time. Um, the mood, like everything's very chill. I know what to expect when I show up. I know that everyone will be doing their job. Everyone is very reliable and dependent. I'd say that I'm sort of the screw up because I'm new. So I have to adapt and I have to learn how to work in this setting. But I mean, that's part of the job. Like that's how it's going to be whenever you apply to whatever position. And so, yeah, very good environment.
Awesome. Awesome. Okay. Um, let me look for some other questions. Can you talk about how the coronavirus has affected anything uh, as far as like your daily interaction with patients? You were working in this position before the pandemic hit, right? Is that correct?
Yes, I started in around January, and actually, so our office closed down and was only doing emergency visits, nothing that wasn't absolutely necessary. And we weren't admitting new patients. So unless you were a patient with us before around the time of March, then you wouldn't be able to see our doctors. And then also in March, another part of my job was actually doing the COVID antibody tests, the rapid tests.
Gotcha.
So that took up a lot of my time there. So I wasn't really doing any sort of medical assisting. Um, I was doing the COVID rapid test from like it would be like 100 tests a day at least every weekday, and um, yeah, it was kind of crazy to see how like it didn't really affect me or my job,
Mm.
but to see how the patients, their demeanor was just had been totally impacted. Like you could see that they were afraid, that they were less trusting, that um, like pretty much a decrease in overall health, I'd say.
Mm. That's interesting. Said 100 tests a day. Is that what you said?
Yes, there were about four of us administering the tests, and it'd be 100 tests a day. Yeah.
That's insane. Um, would you say that your field is expanding and or developing into any new directions? Could you elaborate on that, por favor?
Um, Medical assisting, I'd say there's always a demand for it. I wouldn't say it's necessarily expanding because there are so many, because our position is dependent on a doctor, so
Right.
we can't assist anyone unless there's someone to assist. So I'd say that in my personal opinion, it may be stagnating because it's just like for doctors to go through medical school and to specialize and to go through through their educational path, there are just so many hoops and ladders, and so it's not really attractive to young people.
Right.
But there's always going to be room for growth in the medical field. There's always going to be something new, like COVID. There's always going to be some way to expand, something unexpected that people will need to face.
Awesome. Great answer. Do you think the COVID situation has played a part in the stagnation that you're describing?
Yes. I know that at my local college, I was in the middle of a CNA program, a certified nursing assistant program, when COVID happened. And I was halfway through. I was really excited to get my first certificate. And it's like bottom tier level nursing, but it was still getting your foot in the door.
Right.
And then they canceled everything, clinicals, everything, all of that. It just meant nothing anymore. It was really heartbreaking. And I know that a lot of nurses that were going through their clinicals and that were in their like graduating year, they were unable to finish. So everything has been postponed until further notice indefinitely in California because, our governor is very strict. And I'd say that this has definitely impacted my state. And as for other states that are more lenient and less strict, I'd say that they're probably getting things started back up. So, hopefully they'll produce their new set of doctors and nurses and PAs and all that.
Awesome. Great answer. So, next question is what skills or personal qualities are important for success in your field? in your opinion?
Empathy, general competence in the field, um, good listening abilities. Doctors can be pretty quick with their orders and demands, so you need to, pay attention all the time. I guess that would go with attentiveness and just a good, rational, reasonable mindset, because sometimes you're not going to have someone to ask around, and you're going to have to make a quick decision, and you have to be confident in your own abilities to do so.
Great answer. Okay. Do you see in your work setting at all, my personal essay is going to be surrounding drug addiction and anxiety. Do you, at your position, encounter either of these phenomena, for lack of a better term, on a daily basis?
So the physician that I work for, he also deals with hormone therapy. And so a lot of women will come in saying that they're feeling, down in the dumps, that they don't have the same energy levels, that their general mood has changed ever since they've maybe gone through menopause, or just gotten older. And so we at our office will do their blood work. We will check their hormone levels, see if they're missing anything, and then be able to prescribe certain creams, pills, shots, things like that will get them back to like normal levels as if they were in their 20s.
Cool. Awesome.
And then you also said, so that would be the anxiety part, right?
Yeah.
Okay. So for the drug addiction, unfortunately, there are some pregnant women that come into the office that are addicted to pills, and we can see, like, they will lie. We will always ask what substances they're taking, because we'd like to make sure they're taking prenatals and certain vitamins that will, create a healthy baby.
Mm-hmm.
And they'll lie about prescription drugs or maybe street drugs. And then in their urine samples, it'll be very revealing. And so at that point, we can refer them to addiction counselors, or if they refuse to stop, sometimes other actions need to be taken, like because the OB that I work for, he will deliver babies that will, come out of the womb shaking with what's it called? I'm blanking on the word. When they don't have access to the drug supply anymore, so now they're shaking.
Mm-hmm.
That word is
detoxing.
Withdrawals. They're going through withdrawals.
Yes,
because they know they don't have access to the mother supply anymore. So it is a very sad and tragic outcome that, of course, we would like to prevent. So that would be an instance of drug addiction in my field.
Awesome. Well, that's our time. I really appreciate you taking this time for me. Is there anything else you want to say before we end?
No, thank you for having me. Thanks for asking me all these questions. It was very insightful for myself. I learned about how I'm doing, how I'm progressing so far.
Thank you so much.